Victims of the shooting in Uvalde, Texas, of course, were rushed to emergency rooms, and doctors across the country, because of this crisis of gun violence in our country, have seen far too many gunshot wounds. Joining us now, emergency physician and academic dean of public health at Brown University, Dr. Megan Ranney. She says firearm injuries are a public health crisis that demand public health solutions right now. Doctor, thank you so much for being with us. I'll let you expand on that thought just a little bit, but so much of the conversation, of course, is about guns, as it should be, about mental health, as it should be, and about all the other factors that go into these horrific tragedies that we seem to see every week now. How do you look at it, though, as a public health expert?
So from the public health perspective, from my perspective as an emergency physician, this is about the very real health impacts of the gun. There are the gunshot wounds, the lost lives, and the ripple effects on communities and on society. And when we talk about preventing something from a public health approach, it's about taking that larger picture approach to creating solutions. Listen, we've done this for problem after problem through the history of our country. We have decreased car crash deaths by more than 70%. We have made huge strides in heart disease and cancer by getting data, by creating solutions that go from the beginning of prevention up through the end of treatment, and then by mitigating the after effects. The tough thing here is that we've not done that for guns. We have been stuck in this gun control versus gun rights debate for far too long, and look where we are. Right, more than a decade after Sandy Hook, and all we're seeing are more school shootings, more gun homicides, more gun suicides. It is time for a different approach, an approach that has been shown to work for other injuries and illnesses.
Doctor, good morning. It's Jonathan Lemire. You're an emergency physician, so you are, of course, sadly familiar with the impact of what a bullet does to a body. There is much as there an effort to change the conversation by some around what's happened here in Texas and in Buffalo 2 weeks prior. This is about guns. These people were killed with guns. Tell us a little bit about what you've seen, what the damage a weapon of war does like this to a person.
It's almost unspeakable what a firearm does to a human body. And I've been an ER doc for almost 20 years. I've taken care of everything from car crashes to heart attacks to COVID. A firearm causes both physical and mental damage that is nearly impossible to recover from. But let me also point out that the point when that firearm gets discharged, when someone shoots themselves or someone else, that is the terminal event in a long series of events that led up to that moment. There are so many places along that pathway where we can and should intervene to reduce the chance that someone picks up that gun in a moment of hatred, impulsivity, racism, or desire for self-harm.
Mike Barnicle, Dr. Ranney's point is underlined about this being a health crisis by the fact that we learned in 2020 for the first time firearms killed more children and adolescents than automobile crashes, which forever was the leading cause of death, and again in 2021.
Yeah, it is a crisis. It's a medical crisis. It's a mental health crisis. Both of those, Dr. Ranney, are absolutely correct. But it's also a political crisis. So what alternative approach that you mentioned earlier, you have an alternative approach to this. What alternative approach is going to supersede the fact that one political party, the Republican Party, and at least 48, 49 members of that party, perhaps 50 members of that party in the United States Senate, refuse to pass or endorse legislation that would prevent an 18-year-old from purchasing an assault weapon?
So, Mike, what's the alternative? Yes, there is a political impasse. We can bemoan that, or we can move forward. We can create evidence-based solutions. We can, yes, put in place extreme risk protection orders and background checks like the retired police chief was just talking about. But we also have to change the community. We have to work with firearm owners and non-firearm owners to increase safe storage. Most kids who kill themselves or kill someone else do so with a family member's gun. You can pass laws about that, but you better believe that you have to get firearm owners believing that that's the right thing to do and working with each other to make that happen. You can also set up community programs that help reduce the risk of injury and death. one of my colleagues, Dr. Gina South in Philadelphia, has shown that if you green vacant lots, if you take those vacant lots in the city of Philadelphia and put community gardens in them, you decrease the number of gunshots, the number of violent incidents of other types, and the amount of anxiety, depression, and stress-sensitive diseases around those areas where you've put a garden in. So there are a lot of solutions that we can take today while also working towards policy change that makes a difference. Saying that we are going to fix this entirely through policy change is honestly a Pollyanna approach, which, as you said, is not the reality right now in the United States.
And one of your solutions sounds simple, but perhaps the most important is identifying people who are at risk, just communities, as you say, looking out for each other. If you see a problem, say something. You may save a bunch of lives doing it. Dr. Megan Ranney, thanks so much for sharing this with us today. We really appreciate it.